Yeah, go ahead.
Go ahead, Raman.
Go ahead. You are from US. You have joined up so early in the morning. You go ahead.
No problem. Yeah, Dr. Nagraj, thank you for joining us. And certainly one of the key aspects of TB control is making sure that the TB medicines are both available, but then used with through our chemist when they're used, that their notification is done. And we'll talk more about that. So thank you so much for being here.
And it's a great opportunity, Dr. Shiva Kumar, that you are here. The objective of our session today is one, to effectively communicate to the entire population of the private practitioners that the nation needs you, and we need your cooperation to eliminate tuberculosis from this country, because it is a doable job. We don't have to do any more research. We have the wherewithal. So we are all coming together now and taking a sankalp. So in that, we realize that there are a lot of gaps also in the understanding. So we need to close those gaps, build wonderful relationships, and try and understand that it's a win-win situation. There are a huge amount of benefits that can come to the private practitioner. I'm not talking of material benefits at all. I'm not talking of money. I'm talking of acknowledgement. I'm talking of reputation. I'm talking of contentment, and many such things. Maybe there is lack of knowledge. So all those things we'll clarify today. And it's a great opportunity that not only the DTO is there, the district collector will be there, to address you the same thing. I'm so happy that, Dr. Nagaraju has joined, because we have to reach out to the pharmacists also. And you, Dr. Nagaraj, has a influence over them. And we are not talking of regulations and penalties. We are only talking of relationship. We are talking of human bondings. That is the touch, and that is the objective of today's session. We will have the WHO consultant also join us. We will have the state tuberculosis officer of Madhya Pradesh, of Karnataka, who would join us and speak to you. So we have the CEO of Zilla Parishad, and she is recently joined. She will also be speaking, and you will get to know how we are trying to expand the reach of the TB program. So, Dr. Manoj, I think you have something in mind to communicate as well.
Sure. So also with us is Dr. Salil Bhargav. He's a co-founder of SETI and also a former DTO, also in private practice as well. Dr. Salil, before we start, maybe a word or so.
Hi, good evening, everybody. I'm Dr. Salil Bhargav. I'm professor of respiratory medicine at MGM Medical College. And I've been to Mysuru at least 2-3 times for different reasons to the medical college. And one of my friends, Dr. Mahesh, is there. So
Yes.
Looking forward to work with you for TB elimination from Mysuru.
Great. And Dr. Mahesh, welcome. We had a wonderful time meeting up with you just about a month and a half ago. You're a very busy private practitioner, and you're very renowned in all of your teachings as a pulmonary and TB doctor. We know of your writings nationally and internationally. So thank you so much for joining us.
Good evening, Dr. Mahesh. So good to see you. How are you?
Just a word, if you can unmute and say hello to everyone, Dr. Mahesh. You may have to unmute. Okay, we might be able to work on that.
Hi, Dr. Salil. Good evening to you.
Yeah.
How are you?
I'm fine. Thank you.
Okay, hello. Yeah. I think it's been unmuted now.
Yeah.
Yeah, good evening to all of you. And it's great to join the meeting and meet all of you.
Great.
Thank you so much for being with us. Yes. Okay, great. So, Commodore Raman. Over
Yes,
to you.
I think we may wait for about 2-3 minutes more, because every time I feel that I should start, I just suddenly see 3 people waiting to enter.
No problem. While we're waiting for people to enter, we can talk about some of the big picture things that CETI has been working on. So SETI, as a nonprofit organization based in Indore, has worked on many ways of improving care with the DTOs. And here we are realizing, and we've realized all along, that the private practitioners and the chemists are critical elements to make life better for our patients, because they come to the private practitioners first. So with Dr. Shiraj, we've made a number of trips to Mysuru and to the south in talking about how we can improve care for our TB patients. And also, I believe we have our WHO consultant with us too, Commodore Raman. Is Dr. Shazia here?
Let me just check up. Shazia? No, she is not yet in.
She may not be here. So WHO consultants are individuals who work very closely with the DTO and make a lot of activities happen, lots of data analysis and things. So I think that's critically important. As we are starting, maybe Commodore Raman, a little bit of your background, and you can share with our group, and the more formal background we'll do when the collector Sav is here.
Okay, thank you, Dr. Manoj. And prior to that, we have Mr. Vishwanath ji has also joined us from Ashray Hasta Trust. Ashray Hasta Trust is our benefactor donor. Dr. Manoj, would you like to speak something about that?
So absolutely, I will. So the very reason we can make these programs possible is because of Mr. K. Dinesh and Mrs. Asha Dinesh, who are Mr. K. Dinesh, as you may know, is the co-founder of Infosys. He and I are colleagues for over 15 years. In fact, I was doing a presentation in Florida in USA when one of his employees saw the presentation and made a call to Mr. Dinesh that there is a doctor in US who's talking about quality improvement and quality. And promptly the next morning, I received a call from Mr. K. Dinesh inviting me to Bangalore. And I made, 2 weeks later, I made a trip to Bangalore. That was over 15 years ago. And then since then, Mr. Dinesh has been part of our SETI advisory team, and his trust and his wife's trust, Ashray Hasta Trust, has made these programs possible. So we are very grateful to them and their collaboration.
Thank you so much, Dr. Jain. And I also take this opportunity to welcome the District Magistrate of Mysuru, Dr. Rajendra. Dr. Rajendra, thank you so much for joining us. It was such a pleasure to have met you in person at Mysuru during our visit. You have been a great source of inspiration, and your incisive and pointed questions have, kept us going. So if you can hear me, if I can, hear your acknowledgement, and we'll start the program.
I can hear you, Mr. Arora. Anyhow, I am traveling as of now. Another 2 minutes, I'll be reaching my home office. Let me connect from the laptop. I'm just using
Perfectly fine.
mobile network. Let me hear the presentation first. Maybe I'll give comments later. But actually, I'll intervene in between and I'll give my comments.
Yes. We will draw you in as and when you feel comfortable. And we begin the session. And I also take this opportunity to welcome the State Tuberculosis Officer, Dr. Anil, who has joined us. So, Dr. Manoj, you were asking about me. I feel very humbled to, tell about myself. But then enough to say that I have been really fortunate. The nation has been kind to me to give me very, very senior and very, very responsible opportunities. And I have been able to do it at national level as well as international level. And people will know us through our work. I am now a transformation leader. and into social work. So I think I will, let it be at that. And would like to introduce Dr. Salil Bhargav, who's the co-founder of SETI, along with Dr. Manoj Jain. He's the head of department, pulmonary and chest physician at MGM Medical College, Indore. He's a participant at WHO Joint Monitoring Mission in November 2019, and has also been the chairman of RNTCV Zonal Task Force, OR Committee, West Zone. Dr. Jain, we have been talking to him, is also the co-founder, is also an infectious disease physician, and also faculty at Emory University Rollins School of Public Health. He is the co-founder of SETI and a topic lead at WHO Joint Monitoring Mission in November 2019. There is much, much more I can talk about Dr. Jain, but at this point in time, I think I would rather invite Dr. Anil Dr. Anil, you have known SETI, you have seen our work. You know that we are now looking at focusing and strengthening these structures. So may I request you to share, your thoughts in a limited time, Dr. Anil?
Yeah. Thank you. Thank you everyone for joining, and thanks SETI for setting Karnataka into the next league of TB elimination activities. Most of them within the TB community know what PDSA stands for and the utilities of PDSA. And this activity of yours is the first step in that direction. Mysuru is or will be the next hub for clinical care. And when I passed out of MMC, there were 3 cardiologists in Mysuru, and 2 of them were interventional cardiologists. 1 was a non-interventional cardiology. And today, I think there will be somewhere around 40 or 50 cardiologists practicing in Mysuru. Similarly, the other day I was discussing with my friends, they said there are around 98 practicing orthopedicians and around 40 to 50 urologists. So there is a huge private sector, and that is an opportunity and a concern for us, because when I look at the performance of private notification in Mysuru, it is always suboptimal. So through this, I request all the private practitioners, clinicians to notify TB patients, so that, private has its strength with its diagnosis or management. Public health has its strength in public health actions, free diagnostics, free drugs. And if we combine these two, it would be very good in TB-free Mysuru activities. I wish to listen to others, so I wish this session a grand success, and the use of this is translated as many more self-notifications from the clinicians, laboratories, and pharmacists that would also help us manage TB better in Mysuru. Thank you so much, the entire CT team, Raman and others, for this wonderful activity of yours.
Thank you, Dr. Anil. Thank you so much. You have always been a pillar of strength for SETI whenever we have taken a project in our hands, and having your good wishes is great. So Dr. Rajendra has joined, and Dr. Manoj, I would like to further take this discussion on with a word of gratitude. Gratitude to the Central TB Division, Government of India, and in particular to the Deputy Director General, Dr. Rajendra Joshi, and to Dr. Anil, STO Karnataka, for reposing their faith in SETI, that we can do it. We can become strength of the district. We can make the DTO team stronger. And also gratitude to the district magistrate, who is, I think, joined now through his laptop, because I saw one name entering. To the DHO, we had such a wonderful time, Dr. Manoj, if you may recall, when we met him. And of course, to our DTO, Dr. Shiraz, God may grant him wonderful health and long life. He has been so persuasive, so spontaneous, so much at it, and he does it with so much of passion. So gratitude to people, gratitude to Ashray Hasta Trust, API, that is behind us, Dr. Manoj, the American Association of Physicians of Indian Origin. We draw a lot of strength from them, and they're playing a very active role. And so is your university, Emory University. So we're thankful to them, thankful to all the private practitioners who have joined us, and pharmacists, WHO, IMA, and ADC. And Dr. Rajendra, are you in a position, sir, to now address?
Okay. Commodore Raman Arora, I'm ready, and let me. Hello, Arora, am I audible?
Yes, yes, sir. You are very, very well audible, loud and clear.
Okay. Good evening to all of you. It's a wonderful session. I met, Commodore Raman Arora and his team. They were here in Mysuru to discuss about strategies to declare Mysuru district as a tuberculosis free. And I could able to interact in brief. At the time, I had discussed some of the strategies to defeat tuberculosis in Mysuru. Mysuru being a very important city in Mysuru, being important district in Karnataka state, and we are having a good number of Karnataka private medical establishments. You all are aware that already central government has declared tuberculosis as a really dangerous epidemic disease, and it's a major health concern, health hazard. For that matter, it would be really difficult for the government or like any administrative setup to defeat tuberculosis without the support of the private medical practitioners. Okay, for that matter, I always acknowledge the responsibility and accountability from the private medical teams. Okay, being a medical graduate myself, actually I have a very vague and a general view about the tuberculosis and its hazards. I would like to draw everybody's attention. Okay, most of the times what will happen that though central government has declared it as a dangerous epidemic disease and it is a notifiable disease as per the guidelines and the statutes and this thing, but I'm not able to like see lot many people. Okay, those usually cater to the need of almost more than 70% this thing private medical establishments. They are not updating. They are not notifying the active cases of the tuberculosis. This has become really, really difficult for the authorities to get to the actual statistics, actual case burden in the district, and what exactly is happening. Anyhow, somehow our entire strategy is getting derailed because we are not able to like notify some of the diseases. Maybe this is because what I have understood from the general practitioners is some person, if somebody is having a continuous cough, and even if he is getting sputum, he would have gone to one particular medical practitioner. That he would have shown, he would have like taken, maybe private medical practitioner would have prescribed some antibiotics and other things. Maybe if it is not getting subsided because of the acid fast bacilli, AFB, this thing, maybe he will venture into like different medical practitioner again. He would have gone to some other medical practitioner. Maybe after giving the brief history, another practitioner would have prescribed different antibiotics. Next time again, the patient will be shifting the doctors. Okay, he would be changing the doctors. For that matter, anyhow, somehow disease is getting spread. Okay, and antibiotic resistance is also increasing. Moreover, the burden of the case.
So while
Sir,
I think
he just got muted. You can unmute, sir.
You got muted, sir. You got muted. No, we can't hear you.
Okay,
yes,
there you
now,
go.
Yes,
Yeah,
yes.
yeah,
there was a small disturbance. The thing is like, because of the patient changing the doctor frequently, and some of the doctors will not be in a position after getting the proper history. The second doctor, the moment he gets to know it's a reluctant cough, and a reluctant cough where like even with some of the higher antibiotics to cure, it would be difficult to cure. That moment itself, that private medical practitioners should enter the details of the particular patient who is having a reluctant cough in an Ikshite portal, or like some sort of like they should notify okay, that part. At least they should come into the radar system of the district tuberculosis officer so that we can track that patient. Anyway, this is not, I can understand there is a private practice involved. There is something called privileged communication and other things. But since it is a notifiable disease and everybody is bound to notify these type of symptoms to health authorities. Okay, maybe I think our health staff also, maybe DHO and the district tuberculosis officer and concerned taluk health officer and everybody, they should be make themselves available to the private medical practitioner, and the private medical practitioner, they should not feel difficulty in reporting the cases to the authorities. Okay, maybe we have to make the things simpler for the private medical practitioner, and meanwhile our authorities also easily approachable to the medical practitioner, so that reporting system of the tuberculosis, at least tuberculosis like symptoms, okay, whatever we call that influenza like symptoms in the COVID, at least somebody is having a chronic cough reluctant to treatment for antibiotics, they should be notified and they should be put into like proper testing, rather than going for like changing of the antibiotics frequently, rather than giving a higher antibiotics without knowing what exactly is causing that reluctant cough. My little request to all the private medical practitioners is to bring it to the knowledge of the health authorities. In fact, I was struggling, maybe not only here, my previous experience in the Dakshin Kannada district also, whenever I was reviewing tuberculosis disease as such in a comprehensive manner in the district, it was really difficult for me to get the actual case burden in the district. Actual case burden. If at all, if I ask our TB officer, what is the actual case? Maybe whatever cases we are getting in our government hospital, they are reporting only those type of cases. But you all knowing actually some private medical practitioners, they contribute to almost 70 to 80% of the health delivery system in India. And they treat a major number of these type of patients, and we are failing to identify at the earliest stage. That is one reporting part. And second part is like prescription of the drugs, and the two, some sort of like uncontrolled, unregulated distribution of the anti-tubercular treatment over the counter, even in a pharmacies. That needs to be properly curtailed, and we are taking it as a drive. Maybe we seek some sort of like greater support from the private medical practitioner and all the pharmacists. Maybe this is one step from administration side to reach out to all the medical practitioners and the pharmacists. We are like requesting them in the beginning. Maybe I think we seriously, I think I know, I'm 100% sure with the support of the IMA and even the Indian Association of Physicians and all the practitioners and other things, everybody is interested. Maybe only thing is like who is walking the first step. And this is the first step. We have started walking towards the medical practitioner. I'm 100% sure with the IMA's instruction to all the fellow members, they all will start reporting, and they will all take the dangerous epidemic disease, that is tuberculosis, very seriously. They will start reporting at the earliest so that we can follow it up. If somebody is not able to take care of their health, there are like some government scheme where we can support all the patients with some sort of like supplementary nutrition program, and there are like some sort of like pension systems also. We can bring them into these type of ambits of schemes where we can help not only to take care through medicine, but also through all the comprehensive improvement of their overall health. With these initial remarks, I don't want to, because there are a lot of experts here. I would like to listen to them also. Maybe as and when is required, I will get myself involved in this thing. But one humble submission to all the private medical practitioners to report that reluctant cough, the chronic cough at the earliest to our health authority, so that we can take these patients into our loop and we can track them, we can investigate thoroughly, we can treat them at the earliest, so that we can make that active cases burden and the actual case burden in the Mysuru districts zero. Eventually, our aim is to make Mysuru a TB-free district. With these initial remarks, I will hand over the session to again Commander Raman Arora. Please take it forward, and I would like to be like audience in the group. Let me see how the proceedings happen.
Thank you, Dr. Rajendra. Sir, you made our work so easy by giving such wonderful, all-encompassing, opening remarks. May I request Dr. Jain?
Sure.
to, for two things, Dr. Jain, my request will be, you are the vision behind this entire thing, and you are in the US, though your heart lies here. Okay, so I have two requests to you, and both of you please comply. One is to, give your thanks to and observations to what the district magistrate has just said, and thereafter, please share your passion and your heart and emotions. Why you are doing what you are doing? Because you're not doing it for money. We are not giving you anything. But yet you are there every day in the morning at 4:30 with us. Why do you do this? Because you are the visionary. I am just an executionary. So please, I want to hear from you, and your thanks to the district magistrate also.
Absolutely. So I'll begin with Namaskar, and Dr. Rajendra, बहुत अच्छा लगा आपसे मिलकर. We met just a couple of months ago at your office, and actually I'll say I was amazed at two levels. One, you're an MBBS, you're a doctor, and you understood the problem right off. And then what you did was you brought in the administrative skill sets that you have. And so much that you have outlined right now is so critical. And all of that begins with our private practitioners and then also their notification. So I want to begin with that. My hello and namaskar to all the private practitioners who are here. I want to thank you so much for being here today. मैं ये बोलूँगा, I'll say this, I am a private practitioner. I am an infectious disease doctor. I was born in India. I trained in US at the age of 10. My parents moved to America. For the past 50 years, I've been coming back to India and working on a problem, a challenge, which we can completely change. Just as we have seen that with polio, we were able to achieve a level of elimination. I have seen that being done in other countries with tuberculosis. And I, along with so many others, believe that we can do that in India. How we will do that is a conversation we will be having today. And in that is the role of private practitioners. So I was not joking that I am a private practitioner. I have an infectious disease practice. I'll be going this afternoon and seeing my patients at the hospital. But you are private practitioners, but you don't need to be worried. I see TB patients, you see TB patients and other patients, but we are 9,083 miles apart, so we will not touch each other's turf in that way. But the private practitioners have a huge role in avoiding the spread of a disease which is entirely preventable. And what I want to talk about specifically is what we can do, what you can do as well. So first, I want to start with, there are a number of patients who have to be notified. In the government sector, we're seeing on an average month that there are about 300 TB cases notification. In the private sector, only about 150 to 200. We're still missing, we believe, we know that from data, that 50% come to private, 50% come to public. We're still missing about 100 to 150 cases each month from the private sector. So I'm sharing with you the broader vision. It is to bring the private doctors closer in line with the public sector. In America, there are a number of doctors who are from the Indian origin. We have an organization, API, American Association of Physicians of Indian Origin. API has many doctors who are from Mysuru as well. And they have also been very supportive of this measure. If we work together, if we can bring a level of work towards and goal towards our patients, collaboratively, we can identify the missing cases and bring them for treatment. You see, the shorter the duration of interval between when they are identified with TB and they get on treatment, or even before they're identified, if we can reduce that time interval, that is fewer patients that the transmission can occur. So I want to make sure that we are aligned with the chemists, aligned with the private doctors. Even though I am 9,000 miles away, I am very much with you each and every day, working towards TB-free Mysuru. And then Dr. Rajendra, our meeting and our conversation, incredibly important. Dr. Anil, we have met a number of times, and your commitment from the state level is enormous. And certainly to have all of our other folks who are here, we'll be working at the panchayat level. So Madam Gayatri, thank you so much for being here as well. And our DHO, Dr. Prasad, and others. These are all critical elements that will make a huge difference in our way forward. So Commodore Raman, with those starting comments, and then I don't need to even mention my very close friend, Dr. Shiraj, who's here. He and I go back a long time. So Dr. Shiraj, thank you so much for leading the effort for making our district TB free.
Thank you, Dr. Manoj. Thank you so much. And thank you, Dr. Rajendra. You mentioned that, we should make the process for the private practitioners simpler, approachable. So let me set the ground rules. And for all the participants here today and all the special invitees, what is our objective of this session today? Our objective is, number one, to first acknowledge and recognize that there is a big room and big role for the private practitioners and the pharmacist to play in Mysuru district to make it TB free. The district needs you, the country, the nation needs you. So the first statement that I want to make is that we need your cooperation. So though there are some regulations and there are some clauses, and we will not even mention that right now, but we also acknowledge that there are gaps. There are gaps maybe in your awareness, maybe in your understanding, maybe you are too busy, maybe you don't know the right procedure, maybe you don't know whom to contact, maybe you can suggest a better method, maybe something more. All these gaps we will close today by a simple communication and talking technique. You are also most welcome to raise your queries either in the chat box or through audio personal communication. The DTO is here, the district health officer is here, the WHO consultants are here, the IMA president is here, the additional assistant drug controller is here, the district collector himself is here. So it is like, getting Brahma, Vishnu, Mahesh, Devraj, Indra, Mata Lakshmi, everybody, and the CEO is here. So, suddenly I spoke about the goddess and it occurred to me that I missed a lady's name. So everybody is here to close those gaps, and we will do it with utmost sincerity and methodology. So also the second rule, I have no option but to talk in English because I do not know your language. For everybody else, Dr. Shiraz and everybody else, as much as possible, please respond to us in your vernacular language in Kannada, so that our view, our thoughts reach out maximum. The full session is being recorded. We will use the clips to spread it further to the private practitioners, further to the pharmacists. And that is the advantage that I would like to bring it to notice of the district magistrate. Dr. Rajendra sir, we will be increasing the scope frequency and format of the TB forum also. We'll be conducting a TB forum. DTU has conveyed to us that he's working towards it very soon. And with these words, if I have confirmation, if Dr. Gayatri is here with us, Ms. Gayatri, CEO of Zilla Panchayat. Ma'am, can you hear me?
So she's yet to join, I think.
Okay. So in that case, Dr. Prasad KH, the District Health Officer, welcome. Such a pleasure to have interacted with you. I have made the general plan of the session very clear. May I request you to give your words and advice and vision for Mysuru.
Good evening, Mr. Arora. Good evening, Mr. Jain and all the private practitioners. Good evening to my Deputy Commissioner and my CEO. Good evening to all. This is a good opportunity we have been given to strengthen our health, per se, the health system in Mysuru. We know health is always a collective action. Health has to be collectively taken up. There is a little disturbance. I'm outside, that's why I'm not able to come on the video. I'll be speaking. So the stake of health in Mysuru is equally distributed. As we are aware, there are about 1,400 private practitioners in Mysuru. So they have about 30 to 40% of the stake. But our health system is moving in such a way that we have to close all the gaps for all the burden of disease, all the modalities of health where we are catering, and depending on the need of the people. So now it's the right time to intervene and take the people of private into confidence for the cause of TB. We are aware, the TB, the government is persistently acting, and we are changing the modes and on the basis of the requirement. And despite of that, even though we have our medical college, our TB sanatorium in Mysuru, we are not able to achieve the 100% case detection rate. As Aurora was rightly pointing out, the stake of private practitioners gap is there. As we participate 50-50, if you take, see, there is a gap of 20% left out in every month. So now we have also come out with new strategies, like we have adopted the public-private interlinking managers, so on. And we have appointed some people who can connect our public and private. But still, we have to be more strengthened. We have to improve our relations. See that we will not miss any cases. See, if the people are coming to private, means the private people are doing very well. They have more confidence in the public. But we have to, at the same time, we have to give them whatever we have to give the best. So TB is the major burden. There's the only infective disease we are left out. So let us collectively act and enact, see that we will make Mysuru TB free. I wish you all the best, private practitioners. This is a session, we'll close all the gaps as Aurora was rightly pointing out. Whatever the issues are there, let us resolve and see that we'll act well and we'll come out with good success. Thank you. Wish you all the best.
Dr. Manoj.
So, Dr. Prasad, thank you so much for your comments. And you rightly pointed out that there are over 1,400 private doctors, and all their collaboration and cooperation is necessary. When we met, we discussed how we could engage many of those, and that they are here with us, and that work is still in progress. And to private doctors, I will say this is a great opportunity. I will say this may be the first time ever such a large number, over 150 private practitioners are meeting virtual face-to-face. Just think about this. With our minds, we're meeting across continents in discussing how to make Mysuru TB-free. So private practitioners, thank you for being here. And Dr. Prasad, thank you for sharing that broader vision with all of us.
So Dr. Shazia Anjum is here with us. She is the WHO consultant and for advisor to NTEP program. And she is associated with SETI for quite some time. She knows our work. She has seen us, as a fledgling. And it is such a pleasure, proud moment to, know that she's continuing in Karnataka and Mysuru. So Dr. Shazia, is my voice reaching you?
Yes, sir.
Welcome, and may I request for your kind words as well.
Thank you so much, sir. Good evening, everyone. Honestly, congratulations, first of all, that so many practitioners have joined on this single virtual platform for a very, very noble cause. To give you a view of the NTB strategy of World Health Organization, we all know that the targets set were as per the baselines of incidence, mortality, and the expenditures on the patient's pocket. So very clearly, it has been articulated that at least 80% of the incidence has to be reduced when compared to the baseline year of 2015. Similarly, 90% reduction in absolute number of TB deaths is what is being eyed at. And most importantly, to ensure that there are zero catastrophic expenses on the patient's pocket. Of course, all these were set as the Sustainable Developmental Goals of 2030. However, our own Honorable Prime Minister, Shri Narendra Modi ji, has now very clearly come out that India will be ending TB by the year 2025 itself. What does this mean to all of us? This means we will need to reduce the TB burden of 217 cases per lakh per year from the year 2015 to at least 44 cases per lakh per year by the year 2025. To be frank with you all, the latest global TB report has brought out that there are 29 lakh 50,000 TB patients in our country, which translates to 210 patients per lakh per year. Are we looking at eliminating TB or ending TB? This is always a confusion which is on our minds. So let me just define what is eliminating TB. When we think of elimination, just like our program spells out, National TB Elimination Program, it says that it is less than one notified case per million population. That is a dream which is much, much far away. However, we are now eyeing at reducing the TB burden. Just now, I heard our Honorable DC sir commenting on the burden of TB in every district. Now that becomes very, very pertinent to all of us because we will need to understand our own TB burden before we plan strategies. And that is how Government of India has come up with a very great initiative called subnational certification to assess the status of movement of these districts towards TB-free status. So importantly, Mysuru is a part this year, and the survey is almost done. We are at the verge of analyzing the final statistics. And probably, sir, I assure you, by the time we meet next, we will have on board the burden of TB in Mysuru. And not just that, at least for Karnataka, we are not looking just at declaring Karnataka as TB-free or Mysuru as TB-free. We are now looking and pointing out at making every Gram Panchayat TB-free. We call this initiative as Kshayamukta Gram Panchayat. In this regard, it is imperative to include all stakeholders, public, private, civil societies, NGOs, TB champions, and everybody in the community. We also have a very unique model of bringing together the private practitioners, and that model is called STEPS, System for TB Elimination in Private Sector. I'm proud to say that almost 400 STEP centers are already opened in Karnataka, where every private practitioner is branded as a STEPS nodal point. And every private practitioner takes pride in and onus of treating his own patients rather than levying the charges to the patient. The charges are actually being reimbursed by the government in terms of incentives. I also know that there are a few chemists who have joined this particular virtual session. These chemists have a very dire role in maintaining the Schedule H1 registers and also notifying any missed notifications. The drug sale data trends, which they maintain, have a very crucial role in analyzing the TB burden in every district. And hence, I now urge all the NGOs civil societies, corporates, industrial associations, elected representatives, Gram Panchayat members, and most importantly, our private practitioners to come together also to address malnutrition, which is prevailing among TB patients. You also know that there is Pradhan Mantri TB Mukt Bharat Abhiyan, where over and above the direct benefit transfer of 500 rupees per month per patient, we also are now looking at donors who can actually benefit the patients with enough and adequate, appropriate nutrition. So this is a wonderful forum wherein now I request all the Brahmas, Vishnus, Maheshwaras, and Indras to come together and eliminate the Yama called TB from Mysuru to make Mysuru Kshayamukta Mysuru. Thank you so much. Vandanegalu.
Thank you, Dr. Shazia. Thank you so much. Dr. Manoj, would you like to add on something?
Absolutely. So Dr. Shazia and I go back long ways. We were together at the Joint Monitoring Mission. I both have a tremendous passion for what we're doing in TB. The 3 or 4 things that Dr. Shazia said, I really think are critically important. There are all the multiple programs in different sectors. So there's programs at the Gram Panchayat level. There's programs for the private sector where folks like you, the private practitioners, and myself, so they're involved, that can be involved. There are programs with chemists, and then for patients, for Nikshay Mitra. Almost every sector has an element of role to play in this. So Dr. Shazia, thank you for sharing that. And of every sentence you said, there is a paragraph and a page and a document that goes in much more detail. So we're delighted to have all our private practitioners here in a first of a kind meeting ever in Mysuru.
Thank you, Dr. Jain. Thank you, Dr. Shazia. And my dear friends, as I told you that, you will know more of me. I'm a very, very selfish, self-centered man. And my problem is that I am suffering from a disease which is called Dil Mange More. So each time, Dr. Shazia comes and speaks, my mind starts thinking, I can take more from her. Dr. Shazia, I am saying it up front in front of 160 people right now. The district collector is also here and everybody else. We will be seeking a lot of your advice and help. You just let us know what needs to be done and have faith in our capability. We have joined the DTO's team. We have become subordinate to the DTO. My entire team has become the secretarial staff to the DTO. We will make it happen. We have made it happen in 547 districts across the country. And we're not talking from nowhere. We can do it. We shall need a lot of your advice. Sadaf is in touch with you. Devlina is in touch with you. And thank you so much, Dr. Shazia. Can I hear your acknowledgement? Okay. Dr. Shazia, do you hear me?
Yes, sir. Thank you so much. And I'm honored.
Thank you. Thank you so much.
There was a little bit of a silence there, Commodore Raman, and I think you got everyone worried, including Dr. Shazia. But I think she was with us, and technology was, and distance may have been the problem, but her heart is completely with us.
No, I know that Dr. Shazia has been so close to us, and I know that we can demand from her, and so we will be. And I'm sure she's only feeling proud about it, that there are people who are wanting to know and learn from her.
So I'm sorry, actually, it was centrally muted. That's why it got slightly delayed. Sorry about that.
Okay.
Okay. So
technology was playing a role.
Absolutely. So ba izzat, bari. Okay. Dr. Prasad, thank you so much, sir. There is and Dil Mange from more from you as well. And these are a few ideas I'm floating. If it will be okay with you, we will make it a point, because if you heard Dr. Anil Kumar, he mentioned the word PDSA. I have not spoken about it yet. Dr. Manoj did not, but that is what we do. We have a tool. We have a magic wand. Okay, we can produce, we can take out items from a hat. You can believe in that. We will make it happen. My proposal, Dr. Prasad, is to make a TB patient and a TB facility so welcoming that every other person who comes to know that somebody has TB, they kind of feel, I should not be using the word happy or excited, but that is what I want to say, Okay, is that the case? Let's go to this facility. Okay. And if possible, sir, and here is my point, all those TB patients who have got notified with Dr. Shiraz, the benefits of other health schemes of your district, of the state, of the center can be made available to them because the records are already there with Dr. Shiraz. So TB patient in the TB facility becomes attractive. So the stigma will be gone. People will be more than forthcoming that, if you are notified for TB, all other health benefits and to the district collector, sir, other social schemes that are there, we have to give them anyway. So if we do it like this, we are just focusing all our attention to that. If it is okay, we can discuss it more, and I'll plan it in the PDSA, and we'll strengthen the DTO to do that. And with this, we come to the main part of our session, and that is a talk show. And now, our dear friends, private practitioners and pharmacists, we will be engaging the DTO, the president of the IMA Mysuru chapter, Dr. Shivakumar, Dr. Shiraz, the DTO, Dr. S. Nagaraj, he is the assistant drugs controller, in a talk. And the talk will be made by none other than Ms. Sadaf Ahmad. She's assistant consultant with us, that is SETI, that is collaboration to eliminate tuberculosis among Indians. This talk has been structured. This talk has been structured with your questions in mind. So maybe we will end up asking all the questions that you have in mind. If there is something left out, please feel free to ask or put in the chat box. Either we will answer it right now, or if it is beyond us, or if we need some decision making, we promise to come back to you. And that's a gentleman promise. So over to you, Sadaf, Dr. Shiraz, Dr. Shivakumar, Dr. Nagaraj. Thank you so much for joining. Sadaf.
Thank you, sir. I welcome all the private practitioners and pharmacists who have joined here today. And as said by Raman sir, this is going to be a panel discussion between me and Dr. Shiraz Ahmed, DTO Mysore. Along with that, views of Dr. Shivakumar and Dr. Nagaraja. So, sir, let us begin, and let us start in a way from the basic thing. When we have been talking about notifying TB patients and doing our best to make the district tuberculosis free. So when we say to notify a TB case or TB notification, what do you understand by that, or how would you define it, a TB notification?
So first of all, I like to thank our beloved DC sir, CO madam, sir, WHO consultant, and city team, especially city team. TB notification begins with the enrollment of suspected TB cases on Nikshe portal. ಅಂದ್ರೆ ನಾವು 2 ವಾರಕ್ಕಿಂತ ಹೆಚ್ಚು ಕೆಮ್ಮಿದ್ರೆ, 2 ವಾರಕ್ಕಿಂತ ಹೆಚ್ಚು ಜ್ವರ ಇದ್ರೆ, ಮತ್ತೆ ತೂಕ ಕಡಿಮೆ ಆಗೋದು, ಹಸು ಕಡಿಮೆ ಆಗೋದು, ಇದೆಲ್ಲ ನಾವು ಸಸ್ಪೆಕ್ಟೆಡ್ ಕೇಸಸ್ ಕರಿತೀವಿ. ಸಸ್ಪೆಕ್ಟೆಡ್ ನಮ್ಮ ಕ್ಲಿನಿಕ್ಸ್ ಅಲ್ಲಿ ನಮ್ಮ ಸಸ್ಪೆಕ್ಟೆಡ್ ಅಂದ್ರೆ ಇನ್ನೊಂದು ಪ್ರೆಸೆಂಟಿವ್ಸ್ ಅಂತಾನು ಕರಿತೀವಿ ಇದಕ್ಕೆ. ಕೇಸಸ್ ನಮ್ಮಲ್ಲಿ ಬಂದ್ರೆ ನಾವು ನಿಕ್ಷೆಯಲ್ಲಿ ಎಂಟ್ರಿ ಮಾಡಿದ್ರೆ ನಾವು ಇದಕ್ಕೆ ನಾವು ನೋಟಿಫಿಕೇಶನ್ ನಾವು ಅಲ್ಲಿಂದ ಶುರು ಆಗುತ್ತೆ. ಯಾರಾದ್ರೂ ಮಾಡ್ಬೋದು, ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊವೈಡರ್ಸ್ ಯಾರಾದ್ರೂ ಮಾಡ್ಬೋದು, ಗವರ್ಮೆಂಟ್ ಪ್ರೊವೈಡರ್ಸ್, ಪ್ರೈವೇಟ್ ಕೇರ್ ಪ್ರೊವೈಡರ್ಸ್.
Dr. Shiraz, you can switch off your video. There is a small bandwidth problem. Just switch off your video, please. Yeah, go ahead, please.
ಇದು 2 ವಾರಕ್ಕಿಂತ ಹೆಚ್ಚು ಕೆಮ್ಮು ಇದ್ರೆ, ಮತ್ತೆ 2 ವಾರಕ್ಕಿಂತ ಹೆಚ್ಚು ಜ್ವರ ಇದ್ರೆ, ಮತ್ತೆ ಲಾಸ್ ಆಫ್ ಅಪಟೈಟ್, ಮತ್ತೆ ಲಾಸ್ ಆಫ್ ವೇಟ್, ಇಂಥ ಸಿಂಪ್ಟಮ್ಸ್ ಲಕ್ಷಣಗಳು ಇದ್ರೆ ನಾವು TB ಸಸ್ಪೆಕ್ಟೆಡ್ ಅಂತ ನಾವು ಹೇಳ್ಬಿಟ್ಟು ಈ ಪೋರ್ಟಲ್ ಅಲ್ಲಿ ನಾವು ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಮಾಡಬಹುದು. ಅಂದ್ರೆ ನಮ್ಮ ನಿಕ್ಷೆ ಪೋರ್ಟಲ್ ಎಂಟ್ರಿ ಮಾಡಬಹುದು. ಸೊ ಇಲ್ಲಿಂದ ನಾವು TB ನೋಟಿಫಿಕೇಶನ್ ಶುರು ಆಗುತ್ತೆ. ನೆಕ್ಸ್ಟ್ ಇದಕ್ಕೆಲ್ಲ ನಾವು ಯಾರಾದ್ರೂ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊವೈಡರ್ಸ್, ಅಂದ್ರೆ ಪ್ರೈವೇಟ್ ಆದ್ರೂ ಇರ್ಬೋದು, ಗವರ್ಮೆಂಟ್ ಆದ್ರೂ ಇರ್ಬೋದು, ಯಾರಾದ್ರೂ ನಮ್ಮ ಯಾರಿಗೆ ನಾವು ನಿಕ್ಷೆ ಪೋರ್ಟಲ್ ನಾವು ಕ್ರೆಡೆನ್ಶಿಯಲ್ಸ್ ಕೊಟ್ಟಿರ್ತೀವಿ, ಅವ್ರು ಇದನ್ನ ಎಂಟ್ರಿ ಮಾಡಿಸ್ಬೋದು.
Okay. So as you mentioned, all the private hospitals, private clinics, government and private doctors, pharmacists, and NGOs who are involved with the any healthcare institution also, they are expected to notify a TB case, right, sir?
Yes, yes, yes.
Yes. So, sir, if one has to notify the case, where can they notify it? You know, there would be any place to notify that case, and how can they do so?
So there is one app called Nikshay mobile app. See, the ಒಂದು ಸಿಂಪಲ್ ಆಂಡ್ರಾಯ್ಡ್ ಫೋನ್ ಅಲ್ಲಿ ನಾವು ಡೌನ್ಲೋಡ್ ಮಾಡ್ಕೋಬಹುದು ಈ ಆಪ್. ಸೊ ಇದು ಆಪ್ಗೆ ನಾವು ನಮ್ಮ ಆಫೀಸಿಂದ ಯಾರು ಇದು ಯೂಸ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊವೈಡರ್ಸ್ ಡಾಕ್ಟರ್ಸ್ ಅದು ಇರ್ಬೋದು, ಇಲ್ಲಾದ್ರೆ ನಾವು ಫಾರ್ಮಸಿಸ್ಟ್ಗಳು, ಲ್ಯಾಬ್ ಟೆಕ್ನಿಷಿಯನ್ಸ್, ಇಲ್ಲಾದ್ರೆ ಬೇರೆ ಹೆಲ್ತ್ NGOs ಕೂಡ ಇರ್ಬೋದು. ಸೊ ನಾವು ಯಾರಿಗೆ ಐಡೆಂಟಿಫೈ ಮಾಡ್ತೀವಿ, ಇದು ನಾವು ಕ್ರೆಡೆನ್ಶಿಯಲ್ಸ್ ಅವ್ರಿಗೆ ಕೊಟ್ಟಿರ್ತೀವಿ. ಸೊ ಈ ಕ್ರೆಡೆನ್ಶಿಯಲ್ಸ್ ಅವ್ರ ಕ್ರೆಡೆನ್ಶಿಯಲ್ ಯೂಸ್ ಮಾಡ್ಕೊಂಡು ಇದು ಈ ಮೊಬೈಲ್ ಆಪ್ ಅಲ್ಲಿ ಪೇಷಂಟ್ಸ್ ಡೀಟೇಲ್ ಇದನ್ನಲ್ಲಿ ಎಂಟ್ರಿ ಮಾಡ್ಬೋದು. ಸಿಂಪಲ್ ಡೀಟೇಲ್ ಏನಿಲ್ಲ, ಇದರಲ್ಲಿ ಹೆಸರು ಮತ್ತೆ ಅವ್ರ ಅಡ್ರೆಸ್ ಮತ್ತೆ ಫೋನ್ ನಂಬರ್ ಆಡ್ ಮಾಡಿದ್ರೆ ನಾವು ಅಲ್ಲಿ ಒಂದು ಯುನೀಕ್ ನಿಕ್ಷೆ ID ನಂಬರ್ ಕ್ರಿಯೇಟ್ ಆಗುತ್ತೆ. ಸೊ ಈ ನಿಕ್ಷೆ ID ಕ್ರಿಯೇಟ್ ಆದ್ರೆ ನಾವು ಫರ್ದರ್ ನಾವು ಇದಕ್ಕೆ ನಾವು ಮೂವ್ ಮಾಡ್ಬೋದು. ಇವ್ರಿಗೆ ಏನು ನೆಕ್ಸ್ಟ್ ಡಯಾಗ್ನೋಸಿಸ್ ಕನ್ಫರ್ಮೇಶನ್ ಆದ್ರೆ ನಾವು ನೆಕ್ಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಕ್ಕೆ ಸಾಧ್ಯತೆ ಇರುತ್ತೆ. So like this, in this Niksha app, we can just we'll give the credentials to those Niksha app users. So from there, it can be notified from there.
Great, sir, great. I understand what you said, but sir, you know, doctors are busy people. You know, there is a lot of footfall, you know, in their clinics, and even for pharmacists also. What if some doctor, you know, because of the patient burden, you know, they are not able, they do not have a laptop, or they do not have the time to notify any case. So what to do in that case? That is a genuine problem, right?
Yes, ಇದು ಎಲ್ಲ ಸಾಧ್ಯತೆ ಇದೆ. ಪ್ರೈವೇಟ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಲ್ಲಿ ಇದೆ, ಇವಾಗ ಸಿಂಗಲ್ ಡಾಕ್ಟರ್ಸ್ ಇರ್ತಾರೆ ಚಿಕ್ಕ ಕ್ಲಿನಿಕ್ ಅಲ್ಲಿ. ಸೊ ಅವ್ರಿಗೆ ಬಿಸಿ ಇರ್ತಾರೆ. ಈವನ್ ದೊಡ್ಡ ಕ್ಲಿನಿಕ್ಸ್ ಇದ್ರೆ ಅಲ್ಲಿ ರಿಸೆಪ್ಷನಿಸ್ಟ್ PROs ಯಾರು ಇರ್ತಾರೆ, ದೇ ಕ್ಯಾನ್ ಮ್ಯಾನೇಜ್. ಬಟ್ ಸ್ಮಾಲ್ ಕ್ಲಿನಿಕ್ಸ್ ಅಲ್ಲೆಲ್ಲ ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತೆ. ಸೊ ಇದಕ್ಕಂತ ನಾವು ಅಲ್ಲಿ ಅಟ್ಲೀಸ್ಟ್ ಆ ಪೇಷಂಟ್ಸ್ ಫೋನ್ ನಂಬರ್ ಮತ್ತೆ ಆ ಪೇಷಂಟ್ ಹೆಸರು ಕಲೆಕ್ಟ್ ಮಾಡ್ಕೊಂಡು ನಮ್ಮ ಸ್ಟಾಫ್ಗೆ ಅಟ್ಲೀಸ್ಟ್ ನೆಕ್ಸ್ಟ್ ಡೇ ನಾವು ಕಾಂಟ್ಯಾಕ್ಟ್ ಪರ್ಸನ್ಸ್ ಕೊಟ್ಟಿರ್ತೀವಿ ನಮ್ಮ ಆಫೀಸಿಂದ, ಅವ್ರು ಕೊಟ್ಟರು ಆಗತ್ತೆ. ಸೊ ಇನ್ ಫ್ಯೂಚರ್, ಇನ್ ಕಮಿಂಗ್ ಡೇಸ್, ವಿ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಡೆವಲಪ್ ಆನ್ ದ ಗೂಗಲ್ ಫಾರ್ಮ್ಸ್. ಸೊ ಇದರಲ್ಲಿ ಏನಾಗುತ್ತೆ, ಈ ಗೂಗಲ್ ಫಾರ್ಮ್ಸ್ ಅಲ್ಲಿ ಜಸ್ಟ್ ಒಂದು ಹೆಸರು ಎಂಟ್ರಿ ಮಾಡಿ ನಾವು ಜಸ್ಟ್ ಫೋನ್ ಎಂಟ್ರಿ ಮಾಡಿದ ತಕ್ಷಣ ಜಸ್ಟ್ ಸಬ್ಮಿಟ್ ಮಾಡಿದ್ರೆ ಸಾಕು, ಅದು ನಮ್ಗೆ ಡೀಟೇಲ್ಸ್ ಬಂದ್ಬಿಡುತ್ತೆ. ಸೊ ಇನ್ ಫರ್ದರ್ ನಾವೇ ಅದಕ್ಕೆ ಕೇಸಸ್ಗೆ ಫಾಲೋ ಅಪ್ ಮಾಡಕ್ಕೆ ನಾವು ಪ್ರಯತ್ನ ಮಾಡ್ತಾ ಇದೀವಿ.
Thank you. And Sadaf, I'm sorry to interrupt you. You know, there are certain more gaps I would like to close. Dr. Shiraz, if somebody wants to learn more about Nikshay software, maybe, you know, whosoever had learned has been transferred or has left or has changed or has forgotten, can you help the private practitioners learn it also?
Yes, sir. Yes, sir. There is one nodal person is there. His name is a private public mix. One coordinator is there from our district. So he'll be in contact with these private practitioners, pharmacists, and lab technologists. So he'll be giving credentials. So if there is any problem, they can contact those to him. So he'll help in even our NTP staff. NTP staff are in the field. The concerned area, one on staff is there. So we'll be giving the contact persons contact numbers to them. So they can contact those people and get it clear, sir. This thing.
Okay. So what you are suggesting is, in the entire district, your facilities are there at many locations, and everywhere there is a trained person sitting who can teach in person. Of course, we can also share video instructions, which we will do. Sadaf, if you can please make it a point for both the districts, write down somewhere.
Yes, sir.
Video instructions to how to, you know, use Nikshay. And even if somebody has totally forgotten the Nikshay ID, or is a new practitioner, he has just started practice yesterday. So what Dr. Shiraz is saying is, if any such thing is there, just connect us to the patient and we will make the entry on behalf of the private practitioner. Am I right, Dr. Shiraz? This is what you're saying?
Sir, we'll put there his credential only, and we'll give his name itself, referred from the particular practitioners. So we'll be helping them, sir.
Okay. So although the amount is nothing much. It is just rupees 500 that, goes to a private practitioner for
Sure.
notifying the case.
Yes,
So
sir.
if he will request you, will he lose that money?
No, sir. We actually if he because amount is very small, just to say as an incentive we are giving to those people, our practitioners, and just to motivate these people to send mobilize more cases, sir.
Yes,
That's all.
yes. So in the sense, even if you will notify it, you will use the credentials of the private
Yes,
practitioner.
sir. Definitely, sir. If the
That small amount also goes to him only.
yes, yeah, definitely, sir.
Okay, okay. Sadaf, please go ahead. I will, keep interfering if you don't mind.
No problem, sir. So, sir, we know that we have to notify a TB case, but when is the right time to notify a TB case? Is there, going to be any delay also if we take a lot of time, we keep, just adding up to the patient details and not notify it on Nikshay? So tell us more about that. When to notify?
Sir, actually, I said regarding the symptoms, that is, we'll call as presumptive patients, presumed suspected cases. As a suspected cases, when it is confirmed, like it may be clinically confirmed, microbiologically confirmed, or extrapulmonary. So, ಇದು ಕನ್ಫರ್ಮ್ ಆದ ತಕ್ಷಣ ನಾವು ಏನ್ ATT ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತೀವಿ ಟ್ಯಾಬ್ಲೆಟ್ಸ್, ಆ ATT ಸ್ಟಾರ್ಟ್ ಮಾಡೋಕ್ಕಿಂತ ಮುಂಚೆ ನಾವು ಈಗ ನಾವು ಅಟ್ಲೀಸ್ಟ್ ಅವಾಗಿಂದ ಅಂದ್ರೂ ಕೂಡ ಅಟ್ಲೀಸ್ಟ್ ನಾವು ATT ಸ್ಟಾರ್ಟ್ ಮಾಡೋ ಆ ದಿನದಿಂದ ನಾವು ಮಾಡ್ಬೇಕಾಗತ್ತೆ. Yes, sir.
Important call. Okay.
Yes,
Now, suppose.
Yes, sir.
Yeah. Suppose I am a private practitioner.
Yes, sir.
And a patient has come to me.
Yes, sir.
He is my patient. I am the family physician for
Yes,
many
sir.
years. I don't want to lose the patient.
Yes, sir.
The patient doesn't want to lose me.
Yes, sir.
But they are poor people. I want to help them also. Is it possible that I send them to you for diagnosis, for sputum microscopy, for X-ray, for comorbidity test, for HIV test, for blood test? Will you do it free of cost?
Definitely, sir. Definitely, sir. In our care hospital, our any health facilities, sir, health government facilities, we are doing a sputum testing, microscopic testing, as well as molecular testing, that is CBNet testing. We are doing free of cost for those patients. And we are got in all our ICT centers, we are doing HIV testing, sir. That is also, we are doing HIV testing also, we are doing the free of cost. And our NCD clinics also is there, sir, in many all health facilities that we are doing. We are testing sugar testing also is going on there, free of cost. So we are doing the all tests for all free, sir, for both BPL card holders as well as for APL card holders. Also, we are doing free of cost for BP for TB is concerned.
So, Mr. Shiva Kumar, I would like to bring you here.
Yes, sir.
What we are doing, we are trying to close the gaps. Here we are trying to, and we'll go more in detail, and then I will engage you more, sir. That, I am a private practitioner. I don't want to lose the patient because there is trust involved. You will talk of confidential issues also. And here is, that all the benefits which are available to a patient which comes through the public route are as much applicable to a patient who comes through a private practitioner. So if a private practitioner may like to oblige a patient or, save him money, it can be done. Your view, sir. Dr. Shiva Kumar?
He may have just.
He was there just now.
Yeah, he was. I think he may have pressed the wrong button in trying to unmute himself.
We will go ahead and then I'll get him in. Yeah. So yeah, go ahead, Dr. Manoj.
Yeah, Dr. Nagaraja is there as well. We can also bring him in as they're coming on. I will say that for the private doctors, I'm thinking of this the following way. TB is a disease that is not just of one person. It is not just one patient. It is actually the entire family that gets affected by this. We know that almost there is a 80% chance of transmission. Suppose if the father has TB, we know the 80% chance that someone else in the family will have. So when you are treating a patient, it's not just treating one patient, that is only treating the father, but you are actually a doctor that needs to then examine the other 4 family members, make sure they have an X-ray done, make sure their symptoms are checked. And so, in fact, it is not just one patient, but becomes 5 patients that you're seeing. And that is how we must think about TB. TB does not occur in an individual and 5 patients. And so the practice grows for you, and you have the resource of having the district TB officer helping in doing the testing and so forth. I believe we've got Dr. Shiv Kumar back. I think he's there. Yes. We may have just, I just saw him.
He's joined, yeah.
Okay. So I think that's really important point to remember, that we don't treat just one patient, but we treat the whole family. And in that way, the private practice certainly grows, and you have a broader scope of there. And then you have the doctors, the DTO with you. Great.
So
Dr. Shiv Kumar is back.
Yeah, he's yeah, Dr. Shiv Kumar, please go ahead.
Okay.
Yeah, you're good, sir.
So what I will do, Dr. Shiv Kumar, that we will go through the next slide also. We will go through all the benefits which a DTO can bring. And then after that, I'll bring you and Dr. Nagaraj both together in conversation, and we will have your views.
Okay.
Yeah. So Sadaf, you may go ahead, please.
Yes, sir. So Dr. Shiraz, I think, sir, you can switch on your video, right, sir? Because the audio is very much clear. Yeah. So, sir, we have talked about private practitioners, but what about pharmacists? How can they help with notification, and do they have to maintain any record of the patients? Is there something related to that you can mention over here?
Yes, madam. Yes, sir. Actually, pharmacist, whatever the sale data of ATT drugs there, they have to maintain H1 schedule register. ಸೊ ಯಾರಾದ್ರೂ ಈಗ ನಮ್ಮ ಫಾರ್ಮಸಿಸ್ಟ್ಗಳು ಡ್ರಗ್ಸ್ ಏನಾದ್ರು ATT ಮಾಡ್ತಾ ಇದ್ರೆ, ಸೊ H1 ಅಲ್ಲಿ ನಾವು ಎಂಟ್ರಿ ಮಾಡಬೇಕಾಗತ್ತೆ. ಇದು ಡೀಟೇಲ್ಸ್ ಡ್ರಗ್ ಕಂಟ್ರೋಲರ್ಗೂ ಕೊಡ್ಬೇಕಾಗತ್ತೆ, ನಮ್ಮ DTO ಆಫೀಸ್ಗೂ ಕೊಡ್ಬೇಕಾಗತ್ತೆ. ಸೊ ಇದರಲ್ಲಿ ಒಂದ್ ಏನ್ ಹೆಲ್ಪ್ ಆಗತ್ತೆ ಅಂದ್ರೆ, ಈಗ ಏನಾದ್ರು ಮಿಸ್ ಕೇಸಸ್ ಇದ್ರೆ ನಮ್ಮ ಪ್ರೈವೇಟ್ ಪ್ರಾಕ್ಟಿಷನರ್ಸ್ ಡಯಾಗ್ನೋಸಿಸ್ ಆಗಿ ಅಲ್ಲೇ ರೆಫರ್ ಆಗಿ ಅಲ್ಲೇ ಬಂದಿರ್ತಾರೆ, ಫಾರ್ಮಸಿಸ್ಟ್ ಹತ್ರ ಬಂದಿರ್ತಾರೆ. ಸೊ ಈ ಮಿಸ್ ಕೇಸಸ್ ಕೂಡ ಇದು ನಮಗೆ ಈ ಕೇಸಸ್ ನಮಗೆ ಸಿಕ್ಕತ್ತೆ ಇಲ್ಲಿ. ಸೊ ಇದಕ್ಕೆಲ್ಲ ಎನಿ ಕೇಸಸ್ ಅಲ್ಲಿ ನಮ್ಮ ಹತ್ರ ಡ್ರಗ್ಸ್ ಅಂದ್ರೆ ಡೀಟೇಲ್ಸ್ ತಗೊಂಡು ನಮಗೆ ಇನ್ಫಾರ್ಮ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಸೊ ಇದು ಮ್ಯಾಂಡೇಟರಿ ಇದೆ, ಯಾಕಂದ್ರೆ H1 ಶೆಡ್ಯೂಲ್ ಇರೋದ್ರಿಂದ ಇದು ಮ್ಯಾಂಡೇಟ್ ಇರುತ್ತೆ. ನಾವು ಎಲ್ಲಾ ಕೇಸಸ್ ಇನ್ಫಾರ್ಮ್ ಮಾಡ್ಬೇಕತ್ತೆ ಒಂದು. ಮತ್ತೆ ಅವ್ರಿಗೆ ಇನ್ನೊಂದು ಬೆನಿಫಿಟ್ ಏನಂದ್ರೆ, ಅವ್ರಿಗೂ ಕೂಡ ನಾವು ಇನ್ಫಾರ್ಮಲ್ ಬೆನಿಫಿಟ್ ಅಂತ ಅವ್ರಿಗೂ ಕೂಡ ನಾವು ನೋಟಿಫೈಲ್ ಏನಿದೆ ಅವ್ರಿಗೆ ಬೆನಿಫಿಟ್ ನಾವು ಇನ್ಸೆಂಟಿವ್ಸ್ ಕೊಡ್ತಾ ಇದೀವಿ.
Great. So you have mentioned that it is mandatory for them to record the information. Has it been mentioned anywhere in any gazette?
Yes, it's mentioned in the gazette notification, gazettement. Regarding notify all communicable diseases to be notified for the private practitioners, and this H1 schedule registers drugs sold is to be notified to the government.
Right. So this is for all the private practitioners, medical laboratories, and chemists.
Yes, ma'am.
So at this point in time, Dr. Nagaraj, would you like to say something about this regulation? Would you like to tell all the pharmacists about this regulation, Dr. Nagaraj?
He was just there.
Okay. So maybe
here his video is on, but I think because of the Zoom technical, muting everybody, he may be unable to mute.
No, it's
Good evening, everyone.
it is unmuted.
Yes, he's on. Yeah.
Good evening, everyone. So Government of India brought amendment to the Drugs and Cosmetics Act in 2013, and it is effective from 1/3/2014. So as per this amendment, all the chemists and druggists, those who are dealing these drugs, they should maintain a separate register for Schedule H1 drugs. So earlier, all these drugs were under Schedule H. So they made a separate as a provision as Schedule H1. Under this Schedule H1, all the anti-TB drugs, antipsychotic drugs, and third generation cephalosporins, they comes under this category. So the chemist and druggist should mandatorily, they have to maintain a register. Whenever they sell this Schedule H1 drug register, they have to record in this Schedule H1 drug register. So whenever we visit the shop, we will check whether they are maintaining or not. So they have to compulsorily maintain. In our Mysuru, there are around 2,000 chemists are there. They are compulsorily maintaining this register and they are compliant. And other than this, they are notifying these TB patients in Annexure 3. Whenever the patient goes to chemist shop to procure medicines, anti-TB drugs, they will record all the details, and all these details will be submitted to the district tuberculosis officer and also to us every month. And apart from this, we have created a WhatsApp group taluk wise. So all the chemists from every month, they will submit the sales particulars of anti-TB drugs to us and also to the district tuberculosis officer. In turn, they are following up. As per this Drugs and Cosmetics Act, they have to mandatorily maintain the Schedule H1 drug register. If they are not maintaining, we will issue warnings and we will suspend their license, and further we will take legal actions by prosecuting them. These are the things we are doing, sir. Our chemists, Mysuru chemists, are 100%, they are maintaining Schedule H1 drug register, sir.
No, I actually got scared, so I removed the gazette notification.
So, Dr. Nagraj, you very much so. So what you're really saying is that this is a carrot or stick approach, that right now it is the carrot approach in trying to encourage the private doctors and chemists to do the right thing, notification, and we'll talk about some of the other things. However, if the carrot approach doesn't work, we have the collector here, we have you here, there is a stick approach which can be very punitive and disruptive to my practice if I'm practicing there. Am I hearing you correctly that this is a carrot, take the carrot now, otherwise the stick is there?
Yes, sir.
Okay, great. So I am follower of Buddha. So, I will take the median path. So I will divide it into two categories. Okay, because we started the session by saying that, legal issues on one side, penal clauses on one side. This is a human friendly building relationship session. So pharmacist, whatever.
Yes, sir, definitely it is a friendly relationship.
Absolutely.
We have conducted many awareness programs and education programs along with Dr. Siraj sir and Dr. Suvarna madam. We have conducted many programs, education programs to our chemists taluk wise. So we have instructed them. We have given direction. So they are maintaining the registers. If they are not maintaining, then only we will go for legal action, sir.
Thank
Otherwise,
you
we
so
don't
much.
go.
Thank you so much. No, very much required, sir. Very much required. The way you have brought it out very nicely, that what is the regulation and everything else, you have given the awareness also, and it is very important for everybody to know what are the penal and what are the legal, penalties after that. So absolutely. In fact, sir, I wanted you to, bring it out because only you can do it, and this way. But I was trying to say that, our requirement now, what is DTO's requirement? Dr. Shiraz, you would request the pharmacist to immediately share the information with you on WhatsApp. Correct? They have to make the entry in the register. That is most important. That is the compliance. But your interest is to get the information immediately.
Okay? Yes, sir, that's all, sir. If we get the reporting daily basis, on daily basis, it will be good enough, because we are getting the reports 100%, as Nagaraj sir told, we are getting the reports. But the thing is, we'll get the reports at the month, end of the month. So if you get it a little bit earlier, so it will be good enough to follow up the cases, sir.
Absolutely. So when I said the median path, this is the request to the pharmacist, that if we wait for 1 month, which is a regulation, Okay? You are writing in the register, which is regulation. You
Yes,
are
sir.
meeting the legal requirements, that is a regulation. But I am asking for something more.
Yes, sir.
I am requesting for something different. I am requesting that moment you have such a patient,
Yes,
take a
sir. As and when, excuse me, sir. As and when they get the patient, as and when the patient comes to purchase the medicine, immediately they will inform to the district tuberculosis officer, sir,
Wonderful, sir.
or the
Wonderful.
coordinator,
Wonderful, sir. Wonderful. That is what is
or the
required.
coordinator, whoever is there. They have the numbers. We have given the numbers. They will immediately inform, sir, without delaying.
Wonderful, sir. And we are also, from our side, Dr. Shiraz will share all the possible numbers, of his contact people, where this information can be shared. So very nice. I'm so happy, Dr. Nagaraj. Thank you so much the way you brought it. And I will keep involving you, sir, in more discussions
Thank you,
as we come forward.
thank you, thank you
Sadaf,
very much.
over to you.
Yes, sir.
And I
So-
think Dr. Shivakumar was also there. I wanted to see if he was there. I wanted to connect him with the API doctors as well. Dr. Shivakumar, were you able to connect? I think you were losing connection. We may
No,
have
he's
lost.
not in.
Okay.
So, sir, we can say as very well, discussed about pharmacists, the same guidelines are there for private practitioners also. And it would be great if they can also share the details of the patient, on the same day itself. I think, yes, Dr. Shiraz, rather than sharing one consolidated report by the end of a month, if
Yeah,
the
that's
same
what.
process can be done like the private practitioners.
Yes, yes.
Right. So now let us, sir, get in. We have already discussed about the incentives, but now let us get into the details of all the incentives. So we know that the private practitioners have to notify, and also pharmacists, they cannot notify, but they can inform about the patients, right? They have to maintain the information of the patient. So what are they going to get out of this?
So all private practitioners, we are for all patients, we are giving free of cost medicines, diagnosis free services we are giving. Still, if the patient wants to continue with the same practitioner, private practitioners, we are will give the choice to him. If he wants to continue there, we'll give the choice to him itself. Even we are ready to keep our medicines in his clinic itself, our private practitioners clinics also. We are ready to keep our government drugs there. So like he himself can act as a dot provider to that patient. So we'll just give the choice to that patient. We are not just taking away from a private practitioner to the private practitioner to the government this thing. We give the choice to him itself. And to that, if the private practitioners notifies the cases, we'll be giving 500 rupees to him. And if he gives the outcome of the treatment after 6 months or 9 months, like that, some extra pulmonary cases, they will extend up to the 9 months. So when they give outcome, we are giving another 500 rupees incentives to the private practitioners. And someone wants to act as a DOTS provider, like the full course, if they want to give the drugs from our side. Even if the DOTS means direct observation treatment, short course therapy, like that is there. So if they wants to give like that, means even for them we are giving 1,000 rupees for those people. And for the patients' benefits, we'll give the one scheme called Niksha Poshan Yojana benefit is there. With this scheme, each patient, maybe BPL or APL is not the matter, but it will be giving 500 rupees to the full course of treatment. I mean, if the patient takes a treatment of about 6 months, or in some cases, resistance cases, the treatment will be extended to the 18 months. Till that time, we'll be giving every month 500 rupees to those patients. The amount will be directly transferred to this bank account. So these benefits are there. So one more new project has been come up, like Madam Shazia Madam told, like Pradhan Mantri TB Bharat Mukt Bharat Abhiyan. In this project, few people are like some corporates or some from politicians or some from companies. Few people will be adopting the patients, TB patients, and they'll be supplementing nutritional. They will be giving a nutritional support or nutrition support or supplements or any vocational skill programs they'll be providing. So we can adopt as we will name them as Niksha Mitras. Niksha Mitra, those people will identify, they will call Niksha Mitras. They'll be adopting some few patients for about for the period of 6 months or 18 months like that. So this program is also going on. So along with diagnostic free and medicine, treatment free, and as DBT also we are giving for the all patients, and along with that we are giving Niksha Mitra facilities also. So it can be for both private patients as well as for government patients. Whoever wants to get it wants this Niksha Mitra facilities, definitely we are giving those who give the consent. We are giving these facilities to those people. So ಸೊ ಇದರಿಂದ ನಾವು ಎಲ್ಲ ಪೇಷಂಟ್ಗೂ ಕೂಡ ನಾವು ಎಲ್ಲ ಉಚಿತವಾಗಿ ನಾವು ಡಯಾಗ್ನೋಸಿಸ್ ಕೂಡ ನಾವು ಉಚಿತವಾಗಿ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಜೊತೆಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೂಡ ಏನ್ ಡ್ರಗ್ಸ್ ಇರುತ್ತೆ ಅದನ್ನು ಉಚಿತವಾಗಿ ಕೊಡ್ತಾ ಇದೀವಿ. ಮತ್ತೆ ಎಲ್ಲ ಇದೇನು ಅವ್ರಿಗೆ ಪೇಷಂಟ್ಸ್ಗೆ ಯಾವ ಪ್ರೋಗ್ರಾಮ್ ಅಲ್ಲಿ ಈ ತರ ಪೇಷಂಟ್ಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟ ಮೇಲೆ ಅವ್ರಿಗೆ ಇನ್ಸೆಂಟಿವ್ಸ್ ಕೊಡೋದು ಅದು ಯಾವ್ದು ಪ್ರೋಗ್ರಾಮ್ ಅಲ್ಲಿ ಇಲ್ಲ. ಬಟ್ ನಮ್ಮ ಈ ಟಿವಿ ಪ್ರೋಗ್ರಾಮ್ ಅಲ್ಲಿ ಅವ್ರಿಗೆ ಪೇಷಂಟ್ಸ್ಗೂ ಕೂಡ ನಾವು 500 rupees ಪರ್ ಮಂತ್ ಅವ್ರಿಗೆ ಪೂರ್ತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಮುಗಿಯೋ ಗಂಟ ನಾವು ಕೊಡ್ತಾ ಇರ್ತೀವಿ. ಜೊತೆಗೆ ಈಗ ನಿಕ್ಷಯ ಮಿತ್ರ ಅಂತ ನಾವು ಏನು ಹೊಸದಾಗಿ ಅಡಾಪ್ಟೇಷನ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಈ ಅಡಾಪ್ಟೇಷನ್ ಅಲ್ಲಿ ನಾವು ಪೇಷಂಟ್ಸ್ಗೆ ನಾವು ಫರ್ದರ್ ಏನಾದ್ರು ಅವ್ರಿಗೆ ಎಕ್ಸ್ಟ್ರಾ ಸಪೋರ್ಟ್ ಬೇಕು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಯಾರಾದ್ರೂ ವೆಲ್ ಬೀಯಿಂಗ್ ಯಾರು ಇರ್ತಾರೆ ಅವ್ರು ಯಾರು ಅಡಾಪ್ಟ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಆ ಪೇಷಂಟ್ಗೆ ನಾವು ಲಿಂಕ್ ಮಾಡ್ಬಿಟ್ಟು ಅವ್ರಿಗೆ ಪೇಷಂಟ್ಸ್ಗೆ ನಾವು ಈ ಬೆನಿಫಿಟ್ ಕೂಡ ನಾವು ನಮ್ಮ ಪ್ರೋಗ್ರಾಮ್ ಇಂದ ಕೊಡ್ತಾ ಇದೀವಿ.
So great, sir. So in a way that it is not going to cost anything to the TB case,
Yes,
and
sir.
all in all, it is going to benefit him. The monetary help is going to be there. The nutritional help is going to be there. The help regarding diagnosis is also would be diagnostic test is going to be there, and plus the connection that the patient is going to have with the private practitioner is still going to be there.
Yes,
You know,
definitely,
yes,
definitely.
you're not going to take away that from the private practitioner.
We give the choice to him only.
Correct. Right. So, right, sir. So after this, if, as you mentioned about Nikshay Mitra, that how we can assign a Nikshay Mitra to a TB case, or if, regarding a referral of any TB case by any private practitioner or a pharmacist, they will need to contact you or your team. So can we have somebody, from your team whom they can contact so that this gap is, closed?
Definitely, there is our, as I said, our PPM is there. Private mix coordinator Chennai Gowda is there. We are sharing his number. There, if you can contact this to his number, or our district program coordinator is Hanmantappa is there. Even they can contact to his, or even they can contact to me only, or I'm sharing our email ID also. So you people can just mail to us. So our many groups are also there. WhatsApp groups also is there. If there is anything needs, you just drop a message. Just definitely will help to those people.
Great, sir. So I know, Raman sir, what you are about to say, and I'm ready to do that on the group.
So please do that, Sadaf. Dear friends, moment the contact details have been shared. All in your WhatsApp group, we are sharing a message right now while we are talking to you, and all the contact details of the district tuberculosis officer and his staff are being shared with you. Various TUs, so whosoever is near your area, we are sharing the details of Ms. Shubhangi Khare. She is the project coordinator from SETI. Her details also. So it should not happen just because you did not know something. A notification was left out. So this is our objective. And with this, we have generally come to the end of our session. If there are any questions that you may have, you can put in the chat box. Otherwise, I'll be very soon inviting our co-founder, Dr. Salil Bhargav, to give the concluding remarks, impressions, and expressions. But if there is any question that is left unanswered, Dr. Shiva Kumar is trying to join. I just spoke to him on the telephone. His network is giving him too much of botheration. That's why he was going back and forth. Dr. Shiva, I don't think he's there. I just checked. No, he's not there. So maybe we will keep his views for another day. Dr. Salil Bhargav, if you can hear me.
Yeah, I'm there. I'm there, Commodore Raman.
Yes, please. Your views, please.
Commodore, good evening, everybody. And in fact, I have enjoyed for the first time such type of great meeting where we are interacting with our most important parts for elimination program, that is our private practitioners and the pharmacists. We have all the stakeholders with us. I've been listening from the start of the program. I've heard our district magistrate, I've heard almost everybody, the WHO consultant and the state TV officers and other people. And what is my message to the team? That as doctors, we have been treating all our patients. It is our responsibility, and in fact, it's our major role to treat our patients, diagnose them and to treat them. So we have simply to notify. That's not a very big deal. It's very simple for all of us, and it has its own importance. We have learned that. As far as the pharmacist friends are concerned, they are the second part of the medical coin, and they have been supporting us, friends. It's not only reporting or it's a mandatory thing, but it's very important to know how many patients are really taking treatment for TB in our city. Mysuru has been one of the cleanest city I know, and it has been a very beautiful city. I wish that it should be a healthier city also. So my best wishes. And I've at least 3-4 times visited Mysuru, and I've met doctors and in medical college also, the postgraduates. And I will be visiting and meeting you soon. But I wish that all of us should dream in the night and execute in the morning about TB-free Mysuru. That is my request, and that is best wishes for this. Thank you, Commodore Raman.
Thank you so much. Thank you so much, Dr. Salil Bhargav, for those kind words. And there are some questions, which one question was, can notification be done on Nikshay website? What would be the answer, Dr. Shiraz? I think the answer.
Yes, sir. It can be done, sir. Website they can download. They can put it they can download it and keep it in our desktop. So through that we can just enroll it, sir. No problem, sir. Website also.
Okay. Thank you so much, Dr. Manoj. If I may request you for your concluding remarks, and then I'll be asking Shubhangi to give the vote of thanks, and we will close the session.
Thank you so much, Commodore Raman, and thank you, private practitioners, DTOs, chemists. We have come a long way in the past hour and a half. So where should we conclude? Number one, notification, a carrot or a stick approach, critically important. Notification is a very important first step. Early detection. We didn't spend a lot of time talking about this, but Dr. Prasad hinted at this, and you know very well, early notification reduces the transmission time. Think TB, anytime there's a patient with fever, cough, more than 2 weeks. The third is not think of only one patient, but think of the entire family as having potentially TB and TB exposure. And so if one person is positive, then make sure to test everyone. And yes, get an X-ray done, and they all become your patients. Not one patient, but you have 5 patients that you must take care of with the help of Dr. Sharaj and his team. Number 4, there is payments that are allowed. There is the Nikshay Mitra program that also allows payments to all the private practitioners. Critically important to take those payments. Help your patients, help your practice as well. And then lastly, what we do as doctors, what I do as an infectious disease doctor, take care of our patients, help them complete their treatment. It's life-saving. So do that. And I know you're already doing that. Let's do all of the other steps, notification and stuff. What a pleasure to be with all of the private practitioners. The doctors in US are completely with you. If you know of doctors that are in America from your area, do let me know. We are happy to connect with them and help them become Nikshay Mitra through the program, and they will support your patients with a small donation. And I can tell you they'll be very, very proud. So thank you so much.
Thank you, Dr. Manoj. Thank you so much. There were 3 questions, and Sadaf, thank you so much for drawing my attention to it. Dr. Shiraz, there is a question that are there something called TB test kits, and can they be made available to the private practitioner? To me, the question is not very clear, but if you can make sense of it.
So TB testing kits are not available, sir. We are not going to give the private. If they are giving, if they want to do it free of cost to the patients, the benefit, we are ready to give our reagents as for the testing. We can give them as a service charges to those people as a diagnosis for this thing.
Okay.
But they had to give free of cost, sir.
Okay, okay. And then one more question is, are anti-TB cards reliable in diagnosis? I did not understand the question very well. If Sadaf, can you tell me who asked the question? We can ask the person directly. And by the time Sadaf does it, we are thankful to Raghulal for distributing 700 nutrition kits in Mysuru. Thank you.
Thank you so much.
So he has been honoring on this 21st by Governor of Karnataka.
Yes.
Raghulal.
Yes.
Wonderful.
So we must acknowledge and appreciate. And I also acknowledge the presence of DTO Shamraj Nagar and DTO Kodagu here amongst us. If any other DTO is present, please.
Thank you, sir.
Thank you, Dr. Anand.
Yes.
Thank you, sir.
Thank you, Dr. Ravi.
Thank you, Manoj Jain, sir.
Yes.
Thank you,
Glad
sir.
to have you.
Manoj Jain,
Glad to
sir.
have you.
Thank you.
Congratulations to Mr. Raghavan. Thank you, sir.
And Dr. Nagaraj, there was so much to learn from you. I will stay in touch with you. I'll come and meet you personally in Mysuru. And
Please, sir, please.
Yes.
Please, sir.
We,
Please.
and
Thank
all
you, sir. Thank you
private
so much.
practitioners. Yes, absolutely. So, Shubhangi, can I request you to now take over and do the thank you to everyone.
Thank you, sir. Good evening to all of you, and thank you once again for joining. I would like to thank all the pharmacists, doctors, our dignitaries and guest speakers who have joined us. Some have joined from different districts also. So thank you very much for joining us today. I would like to extend my thanks to Dr. Rajendra sir, our Deputy Commissioner, CEO Madam, STO sir, WHO Consultant Madam, DHO sir, IMA President Dr. Shiva Kumar sir, Dr. S. Nagaraja sir, Dr. Shiraz sir, and the entire NTEP team of Mysuru for doing such a hard work and taking all the efforts for this program. I would like to thank specially to Ashray Hasta Trust, K. Dinesh sir, Asha ma'am, Vishwanath sir, and Vikram sir for supporting us in this project. I would also like to thank our all-time supporters, Central TB Division, WHO, API, and Emory Global Health University. And lastly, our day in and day out support, the SETI team, the SETI admin team, and the SETI IT team. Thank you, faculty members as well. Thank you, everyone. Thank you.
Thank you.
Thank you so much. And thank you, wonderful people.
Thank you, Shiraz bhai.
Thank
Thank
sir.
you.
Thank you, sir.
Thank you, everyone. Thank you, Dr. Shiraj, for all your leadership and great work.
Dr.
Wonderful.
Shiraz, together we will make Mysuru TB
TB free.
Thank you, sir.
Good work. And good.
DTO Kodagu is here.
Yeah.
He was there yesterday also. He's here today
Yes.
also. Dr.
Yes.
Anand.
Yes.
Thank you, Sadaf.
Yes. Thank
Dr.
you.
Evening, Sadaf. Thank you.
Thank you for coming.
Thank you, sir.
Also, Dr. Jay Kumar, who is the ex-DTO Mysore, had
Of
also joined.
Mysuru. Yes.
Oh, thank you, Dr.
He has
Jayakumar,
left
for
by
being
now.
here.
I was about to inform, but by that time he had left.
Okay, wonderful. Great to have so many people. Thanks, everyone.
The district collector had left in between, so I did not, call him again.
That's
and
fine.
Dr. Shiraz, Dr. Shiva Kumar, we missed today, but we
Yes.
will get him again.
Okay.
Because through him, a lot of messages have to go, because his reach is far and beyond to all the private practitioners.
Definitely.
Yeah.
And we can get all of if there are NRI doctors, please send me their names and we will bring them connected to the program. So Dr. Shiraj, any NRI doctors, we're putting together a program they will become Nikshay Mitras.
Okay, sir. I just pass the message to sir.
Please, yes, let us know. Great.
Okay, thank you.
All right. Thank you, everyone. Take care.